Welcome to the Empowering Minds Mental Health Podcast, where we explore mental health, life changes, and development. Today, I'm excited to welcome Donna Moss, a very experienced guest. With more than 30 years' experience, Donna has helped teenagers, young adults, and families with various issues like stress, anxiety, parenting, divorce, women's concerns, and more. Donna has worked in important positions in both corporate and nonprofit healthcare organizations. For example, she was the National Director of Patient Services for the Leukemia Society of America and a health educator for the New York Association for New Americans. Currently, Donna is the clinical supervisor at Solace House USA, where she continues to help people navigate life's challenges. Donna, thank you for agreeing to come on the show today.
Thank you so much. I'm glad to be here.
Absolutely. All right. So we're just gonna jump right into some questions. Um, what are some of the most common mental health challenges that teenagers face today, or at least maybe in your expertise that you've dealt with?
Right. So during the pandemic and a little before, and I guess a little after, there was reporting that there's a huge uptick in anxiety, especially with young girls. Um, and since I happen to work with young women, teenagers, and young adults, and anxiety, and then the pandemic hit, it became like the perfect storm for me
Mhm.
because everybody was reporting more anxiety. Like I got pretty much a call a day for new appointments. So, thankfully we had the telehealth option. So we all could see a lot more people from around your particular state, so, but it was real. I mean, it was real in my experience, and it was real statistically that there was this uptick because they were locked in their rooms for 2 years and they had nothing to do but overthink.
Mhm. Yeah, that definitely was a tough time for us all. I mean, even as an adult, I
Hmm.
had my own issues with anxiety because I wasn't used to working from home. Before I kind of did like hybrid, like 1 or 2 days a week, and that was okay. But
Hmm.
yeah, having to, kind of go through that lockdown process, that was a big impact. So I also noticed that same thing in my local community too, with teens increasing anxiety. And with the increase of anxiety, it also increased substance abuse you
Hmm.
for youth.
Right. Substance, depression,
Mhm.
trauma. Everyone thought they were traumatized. The most popular book on the New York Times bestseller list was called The Body Keeps the Score, which is a book by a like not previously not well known psychiatrist. Why was that the number one book? Because the whole world was traumatized.
Right.
So it's interesting. So I started to expand my learning on trauma
Mhm.
and kind of embrace a more of a mind body approach and help the teenage, mostly girls, get out of their heads again and back
Mhm.
into their lives.
With you saying that, how can parents and caregivers recognize like early signs of mental health struggles with their teens, or it might be their grandchildren, family, friends? What are some signs that maybe they can kind of pick up on?
Right. So anyone can Google the signs and symptoms of different mental health issues, right? And that hasn't changed
Hmm.
so much. But I think that the way we frame it is different. Like for me, I take a holistic approach. Like you're not
Hmm.
just your diagnosis that you heard about on TikTok. You're a
Hmm.
person, a whole person, and you just start the inquiry and the exploration of what has happened along the way with each individual, where they're at. That's a big tenet of social work is meet the client where they are.
Okay.
And then you begin to gather data. And sometimes, like a teen or a young adult is just going through a rough patch.
Mm-hmm.
And that's okay. And you're getting help and you're doing better and you can see the changes. You can measure and see. And those are wonderful cases because you know that they will go on to just continue on their path.
Mm-hmm.
But when the red flags start to stack up is when then it may start to look more like a crisis
Mm-hmm.
because nothing is working. There's not enough support. You know, family is breaking down in some way, or the kid, like I had a client that, she just basically had no money and she wanted to apply to college. She's a bright girl, but all the barriers and no one to help her,
Mm-hmm.
you know, and just so little things start to stack up and create bigger problems.
I do like the holistic approach too. I was actually at an event this past weekend, and one of the questions from a parent was basically, when you recognize these things with your children or family member, do you go ahead and start seeking help then and resources? And I said, yeah, ab absolutely.
Yeah, absolutely. Because, you know, you don't want to make your child into an experiment. Help
Mhm.
is available,
Mhm.
and there's no shame in it. There's no stigma in it. We'd
Mhm.
rather I had one young adult client say to me like, "Oh, I'm afraid my problems are not significant enough for therapy." I'm like, "Your problems are your problems. I'm not here to judge anything."
Mhm.
It's like going to the gym. It doesn't have to be such a big thing.
Mhm.
It's just what you do to maintain some balance.
Absolutely. And that's why,
One of the things, not the only thing. Yeah.
right. And that's why I'm glad you agreed to come on, because that's my main goal, is to break the stigmas around mental health, because a
Mhm.
lot of people uh they they recognize that, hey, I have some issues going on, but because of the stigmas, they won't seek treatment. I mean, I know people who have a great built-in plan with their health insurance through their job with no copay, but they will not take advantage of the resources because they feel maybe someone may judge them or look at them a little
Label
differently
them.
or
Hmm.
label them. Right.
Right.
And I encourage people all the time, you are really winning when you step out and you get the resources that you need. There's so many resources, so there's no need to just kind of like suffer in silence.
Absolutely. And we got to keep reinforcing that. I'd rather know than not know.
Hmm.
And me personally,
Right.
um, because then you can deal with it.
Right. Yep. Learn some skills, coping skills.
Hmm.
And earlier you were talking about the trauma and different things associated with the pandemic. And so I want to ask you this, because social media time definitely increased for everyone. So,
Hmm.
what role does social media play in the mental health of teenagers, and how can it be managed in a more positive way?
Yeah, so I don't like it when people say like, "Oh, it's social media's fault," because that oversimplifies it. Social media, like anything else, can be used for ill or can be used for good. And in the beginning, since I was an early adopter and I was in the internet space like as early as 1999, millions of people got online then for health. I happened to be in a health care thing,
Mhm.
like all the people with breast cancer, all the people with fibromyalgia, all the people who wanted to quit smoking. What a beautiful use of the internet,
Yeah.
right? Or God forbid, a child is isolated by some health problem and
Hmm.
they can't leave the house. Beautiful application of social media to be able to
Hmm.
connect with your peers and not be alone.
Right.
So the internet can be used to create revolutions, like we saw, I think it was Egypt, um, or it could be used to numb your brain, just like sex, drugs, rock and roll, addiction, etc.
Mm-hmm.
You decide. You decide if it's going to be a good or an evil.
Yeah.
But the problem is that girls are spending about twice as much time as boys on their phone.
Mm-hmm.
So they get lost in it. They get lost in the FOMO. It's real. It's valid.
Mm-hmm.
And they literally just have to put it down. And there's a guy out of NYU. His name is Jonathan Haidt, Haigt. And he says that put the phone down during school and put the phone down at 10 p.m. and you'll get a result of a more rested child. It's sleep and put the phone down. It's so simple. Is it the social media's fault? I don't know. You know, it's a tool that you decide how you're going to use it.
Yeah. Yeah. That is.
But girls are so heightened to attachment and
Mm-hmm.
relationships and
Mm-hmm.
connection
Mm-hmm.
and trauma bonding, whatever you want to call it. That's how we're wired.
Right.
So they can easily get lost in it, and they don't have the tools to come back to themselves in a more uh, you know uh, innocent way.
Mm-hmm.
And then at the same time that all these kids got their phones around 2011 is when we started to see the uptick in
Mm-hmm.
the suicidality, the anxiety, the depression, especially again in young girls. So there, it does correlate.
Mm-hmm.
Um, and those kids also, at the same time, the parenting styles became
Yeah.
more restrictive. Don't
Mm-hmm.
go out, stranger danger, blah, blah.
Mm-hmm.
So all of that created a setup for these kids to be uh, more left, I guess, to inside their heads. And we all know what happens when you sit around and you ruminate all day. It doesn't resolve. It just loops around and around.
That makes sense. When my son was in high school, um, and I don't know if they still do this or not, but the plan that I had, um, after a certain time of night, I mean,
Mm-hmm,
I would have his phone. The
mm-hmm,
only people that could contact him was like immediate family. And of course, they would only call in case like an emergency or just to check in. But that
mm-hmm.
was how I kind of managed his social media time. I'm thinking during the daytime you're at school,
Right,
you don't need to be on social media. So
right.
the outlet sometimes that parents maybe could check into if they're on like a family plan or something like that to kind of
Yeah, yeah. It's
manage it.
absolutely very easy. And I wish I did it with my kids, but I didn't realize. But and some kids are better at it than others. Some kids can
Yeah.
juggle a million things,
Yep.
and some are not. They're not cognitively mature enough to do
Right.
to switch gears like that.
Mm-hmm.
Like you'll see, the classic distracted kid is the kid who's really smart, does well in school, did the homework, got it right, but can't find it in his
Yep.
backpack. That was me basically.
That is so true.
Right?
Yeah.
It's the frontal lobe, the executive function, the organization, the ability to plan, to think ahead. They don't have that yet in high school.
Absolutely. When I worked in public schools, that is exactly what I saw. And I used to think, how in the world this young lady or this young man, they're
Mm-hmm.
absolutely brilliant. But yeah,
Mm-hmm.
they were really distracted. And the phone was the
Mm-hmm.
main distractor. So
Yeah.
yeah. And so let me ask you this last question. How can teens be encouraged to seek help when they're struggling, but they might be reluctant to talk about their feelings?
Well, it's difficult. Let's say under 18 to land yourself a therapist without your parents
Yep.
knowing. I don't know the full on answer to that. In New York, we have 988. We have
Mhm.
crisishelpline.org, which meets
Mhm.
them on text. There's suicide hotlines. There's more. There's more
Mhm.
available now. But again and again, there's still barriers to access and the cost. I mean, honestly, I could probably charge double for the last couple of years, but
Mhm.
I won't do it. I like because I want it to be accessible for everyone, not just the elites.
Mhm.
So it is a big question, how do people get access and to this stuff? But things are moving in the right direction. It's just not, therapists need time off, they need
Yeah.
benefits, they need
Mhm.
higher pay. If we could get all that stuff together, maybe there would be more available.
Mhm. Absolutely. Okay. Well, I don't know. I'm gonna leave this last few minutes for you. I don't know if you have any maybe books or articles that you have written that you want to talk about, or if you
Mhm.
have a something that you want to resonate to the viewers who will watch this later on.
Yeah, sure. So I worked with this wonderful designer, brand designer last year, and she helped me develop my webpage, which is donnacmoss.com. And from my webpage, I'm now offering a course, a paid self-paced 4-module course where you can hear me blabbering and look at some slides and, kind of get the hang of how this works. And
Mhm.
it's like it's a package deal.
Okay.
And anyone could buy it and have it forever as part of their training into if they want to deepen how they understand working with teens and young adults.
Oh, well, thank you for your time today. I'll be in contact with you soon to share the links and everything with you.
Uh-huh.
Okay.
Great. Thank
All right.
you.
You take care. Thanks again.
Okay.
Take care.